Today we'll be talking about the endocrine system. Here we see the testis and the parathyroid, which are two of the organs that we'll be covering this session. We talked about the thyroid, but now we're going to talk about the parathyroid. Para means near thyroid, and there's a couple of cells. The chief cell, the principal cell, is the one that make the parathyroid hormone. There's also oxyphils, which are located in another cell that's in there. We don't know what it does, but it's an interesting cell that's there. Here we can see the oxyphils right in through there, and then these are the chief cells. And you can see a rich vascular supply around there as well. Oxyphils, chief cells. Oxyphil cells are very big, and they have a small nucleus. So there's a lot of cytoplasm between the different cells, and also it's light staining. So these with a large nuclei in through there and blue cytoplasm around it are the chief cells, the main ones that produce the parathyroid hormone. And here we can see in another slide 484 the chief cells and the oxyphils. Now remember, when we were talking about bone, function of bone, calcium regulation was a big function. And remember that the hormones are involved in tightly regulation, about 1/4 of free calcium in blood exchange every minute. That's pretty good. And the parathyroid hormone acts by stimulating osteoclast production. So you have a greater number of osteoclasts when parathyroid hormone is prevalent. In fact, there's a disease with too much hyperparathyroidism. Osteoporosis is due to, or the weakening of bones and the elevation of calcium whenever you have that disease. In next organ is the pancreas, and of course the pancreas has the pancreatic acinar cells that we see around here, and we can see in this duct the pancreatic acinar cells. But then also it has the alpha cells and the beta cells of the islets of Langerhans. And here we see those islet cells right in here, lighter staining cells that we see, and then the pancreatic acinar cells that we see throughout. This is slide 158. Now if we check out slide 156, this is the monkey pancreas. We can see the islet cells and the pancreatic acinar cells with the zymogen granules just about to be released in the lumen. Another one is a rat pancreas that we can see. There's an islet. It's a lighter staining islet region that we see through there, and then you can see the pancreatic acinar cells here. So this is a exocrine component, and the islet is an endocrine component of the system. Here we can see the ovary and the female reproductive tract. The ovary produces hormones, and it produces the egg too, in relation to hormones that come from the pituitary. Meanwhile, it produces estrogen and progesterone to feed back on the hypothalamus. Here we see the ovary with some follicles of various stages of development, and this is a corpus luteum, which is responsible for maintaining pregnancy. If we look at this electron micrograph 24, we can see that the corpus luteum cell has a lot of smooth endoplasmic reticulum, and also lipid droplets as well as a host of mitochondria. All of those are characteristic of steroid secreting cells. Another characteristic of endocrine system is a rich vascular supply, and we can see the blood cells, the red blood cells in the capillary, very close to these endocrine cells. On the male side, we have the testis. The testis produces testosterone. It receives LH and FSH from the pituitary to stimulate it to produce germ cells, to stimulate Sertoli cells, FSH does, and the Leydig cells, LH stimulates them to produce testosterone to maintain the secondary sex characteristics of the male, and also to maintain secretions. of the various glands, the prostate, the seminal vesicle glands, as well as the maturation sperm in the epididymis. So here we see in 165, these are Leydig cells that produce testosterone when LH is stimulated by LH. And then here we see a host of germ cells, including Sertoli cells. Here's the Sertoli cell nucleus here, here, and here, which is stimulated by FSH, follicle stimulating hormone, which also causes follicular development in the female. So in the Leydig cell, this happened to be of a horse, but we can see a host of smooth endoplasmic reticulum. A little bit of RFER can be found, but lipofuscin granules characteristic of those. A lot of mitochondria with tubular type Christi as well are in there, but just a remarkable amount of endoplasmic reticulum. And also here you see a gap junction between two adjacent Leydig cells. Also, below the brain, in addition to the hypothalamus or the hypophysis, which is the pituitary gland, we also have at the back at the pineal. The pineal gland is important in production of melatonin, which regulates our circadian rhythm. And if you look at the pineal, it has what they call brain sand. It's really when you process this, it's very brittle, and so it's really hard to get a nice section of this. But these are the cells that produce that hormone. So regarding variation in microvasculature, remember we said the common thing is to have arterial, capillary, and then venial. That's your typical thing. There also are portal system. You have a venous portal system where you have a capillary network, a portal vein, and we have an endocrine system. Example of that. There's also arterial portal system where you have a portal arteriole in the middle between two capillaries. There's an endocrine example of that. And so the first capillary network in the venous portal system is in the hypothalamus. So you have neurosecretory cells releasing factors that go into the hypothalamus, and then they go through the portal system, and the second capillary network, benefiting from that locally modified blood, is going to be the pars distalis, which you have the citrophils and the basophils there. And here we can see a venous portal system. This is the infundibulum stalk coming right down here. First capillary network, here's a pars distalis, and we can see the rich vascular supply that's in there. The first capillary network we don't have in view. That's actually in the hypothalamus. However, we do have the portal vein in the stalks. Portal veins coming down, and then ultimately the second capillary network is going to be in the pars distalis itself. So you got releasing factors from the hypothalamus, modifying the blood composition, comes through the portal vein, and is distributed out through here to be affected to affect citrophils and basophils who produce their hormones. Now, there's also arterial portal system. The arterial portal system is here in the pancreas. So here you got the pancreatic astral cells in through there, capillaries in the ilex of Langerhans. The first capillary network is in the ilex of Langerhans, and it picks up glucagon and insulin in through there. The second capillary network benefits from that modified blood is the astral cells themselves. So glucagon stimulates, glucagon inhibits, and insulin stimulates the pancreatic astral cell secretion. So here's another pancreas happened to be in the rat, and you see a host of blood vessels in the ilex cells. Look at all these blood vessels in through here, and then the blood vessels that you see over here of the pancreatic astral cells too. So this is arterial portal system, and the first capillary network is going to be in the ilex of Langerhans itself. The second capillary network is in among the pancreatic astral cells. So this is a portal arteriole that connects those two, and that's one of the reasons maybe the main reason that you have islets of Langerhans distributed throughout the pancreas as opposed to them being all on one side, because they have local connections with a little local portal arteriole to connect the modified blood that's in the first capillary network, modified composition of blood, to enhance secretions around the second capillary network.